Verena wanted to make sure that the slides are up so you all know you're not here for biochem review session.
Yep.
You're here.
Get covered, Carolina.
Get covered. Yeah, so everyone's in the right place. Awesome. And we're going to be learning for the next month about how to become a volunteer with Get Covered Carolina. So we're so happy that you're here with us. Let's go ahead to the next slide. So our agenda for today is that we are going to, not yet. Have we recorded?
Yes,
okay,
we started recording.
Okay, great. So SHAC, what is SHAC all about?
Okay, awesome. So SHAC stands for the Student Health Action Coalition. What you guys are here for is Get Covered Carolina, which is one of like many branches within SHAC. But SHAC as a whole, we all share the same mission, which is helping people that are either, like low income or just don't have access to healthcare, basically helping connect them with resources, provide care, all sorts of different things. And so that's why we say interdisciplinary several times on here, because within SHAC, there's a lot of different people working together. The medical people are working closely with social needs people, and everyone's just trying to help our communities in their own way. And when you talk about GCC specifically, we're helping the uninsured and underinsured people within sort of the triangle area get connected with health coverage, while aligning ourselves with this overall SHAC mission. But yeah, that's what SHAC is.
And so the four of us are part of Get Covered Carolina. Verena and I are the co-directors this year, and then Grayson and Yash are your training coordinators. And Grayson and Yash have been here for quite a while. They're really well versed with the clinic, so they'll be able to get you all situated with everything that you need to know for your time at clinic, so that we can serve our community in the best way possible. Verena and I are also in clinic often, and then you all will meet some of our other wonderful people on our team. Tiffany and Megan are some of our other coordinators. I think Annika stepped out for just a second.
She's printing stuff for us, but yeah.
Printing stuff for us, yeah. She's our marketing coordinator. And then lastly, we have Dorian, who's our virtual clinic coordinator. So we're a big team, and all of us are resources to you all during this training session. Great. So let's go to the next slide. Wonderful. So our agenda for today is that we're going to start with some of our CMS training materials. Now, before I even jump into modules 1 and 2, has anyone gotten through and been able to set up our CMS account? Raise your hand. Yes.
All right.
A few people.
Wait, raise them high.
Yeah, raise them high.
Okay. Yay.
Okay.
Awesome. And we've done our modules too. Yes. Awesome. Great.
Woo.
If you've not, props to you, because I know you're working super hard to get verified right now. Okay. And I know that's a really long process. Grayson, Yash, do you have some advice for that process right now?
Wait, so raise your hand if you're trying. It's okay if you haven't tried to, oh, okay.
Yeah.
Okay. Yeah, have any of y'all sent us emails, or Yash has to run, but I'm able to stay after and we can try to troubleshoot it together. There's a phone number. I don't know if Yash got a chance to be able to send it to y'all, of the Experian number.
Yeah, so I've been sending out, there's the training sort of PowerPoint with like how to get onto CMS. I know that had some numbers on there. And then I think some of y'all have reached out to me or reached out to us on email, and I emailed back with like an additional number. That number, I've had volunteers try that earlier this year, and like it's like work verifying their identity. But if the responses that all of y'all are getting is like to send in the documents and it's taking like 7 to 10 days, I think that's like the route that we'll have to play with, because like that's sort of like how the way that we're gonna be able to verify that identity. So we're just gonna go forward with that and just wait the 7 to 10 days, and we can always work on the modules after that. And we still wanted to say it's very important to still come to the trainings, because the trainings are going to help supplement what you do in the modules. And you may actually see that, if you come to the trainings, we help break down what's in the modules down. So when we actually do the modules, it may be like much easier to look at and understand. And like I said, we can stay after if you want to like show us your specific like situation, things like that.
Yeah, the modules do take quite a while to get
Yeah.
through, but just be diligent. This is a process. CMS is, we work with CMS, but we can't really control the process and verification. So as long as you're diligent, we will kind of help you as much as we can to make sure that you're able to get that done. But really, it's most important that you have your modules sent by the end of the month. So we still have some time. And like Yash said, we're going to make sure that you actually get the really important stuff while you're here at training that you really need for your time. So I guess that means that we have a lot of people who will be learning some stuff for the first time, right? We have 5 people, I think, who have looked at this material before, but majority of us will be seeing this for the first time, which is actually kind of fun, right? We're gonna be learning a lot together. Let's go to the next slide. Actually, just jump to the second slide for a second.
Sorry, wait, beforehand, since a lot of y'all have not seen it before, I see a lot of computers. Try going to the healthcare.gov glossary site, the link that's down there, because it has a lot of the terms that we'll be talking about as well.
And we're taking it very step by step today,
Yeah.
so hopefully you guys don't feel overwhelmed at any point. But feel free throughout, just ask questions as you need to. This is a safe space.
And kind of along that point, can you skip 2 slides?
2 slides.
Yeah. Or 3, so one more. So along that note, we are hosting these trainings to get you acclimated to what we do in the clinic, which we can attest, there are a lot of things that we do in clinic. And there is a long learning process, that's for sure, and that's why we have 5 training meetings that we'll be hosting. But this is a lifelong learning process, and every single day, even yesterday at our Wednesday clinic, we're constantly learning new things. And that's kind of what we pride ourselves in, is just being able to adapt and learn and find resources. We like to think of our volunteers as expert problem solvers. That's what we want you to become as well, okay? So this is a learning process. We're never gonna have every single bit of information, but as long as you keep that open mind and that growth concept. But we have created this resource, which is new for this year, and so we really hope this is helpful for you. You can use it however you like. We're not gonna collect it. It's not a class assignment. So just use it as is beneficial to you, kind of like your notes. And we'll have one for each session that we're. Awesome. Now you can go back 2 slides and turn it.
Yes, so this is the plan. Today is training session number 1. There are gonna be 5 total. All of them but 1 are gonna be on a Thursday. There's only one of them that's on a Tuesday. This one, yeah, right there. And the reason for that is we were trying to avoid the kind of big gap with break and everything. So hopefully this makes things a little bit more streamlined for you guys. And yeah, so these are, and the rooms for all of these also change, so make sure you guys check the email for where you're supposed to be. But this is the plan. After these 5 trainings, we're gonna cover all of the major points from the modules, and so that's gonna be our timeline. And then this last session here, this is gonna be more focused on things outside of the modules that are still very, very important to know for clinic. Like all of the stuff that we deal with on a daily basis, but isn't necessarily directly related with CMS. So yeah, all of them are just as important as the next one to attend. And yeah, that's the plan.
And we've had a few people, obviously not anyone in this room, but we've had a few people here listening to this recording who have let us know that you can't be here, which is perfect. You need to definitely let us know if you cannot attend. These trainings are really vital for us to make sure that you have all the information that you need to attend clinic. We've seen that our volunteers who attend the cohort training and are kind of with each other together in this process really do have a better experience in clinic. So just kind of keep that in mind, that it's really, really important for you to be here and also contribute to the conversation so that you get the most out of this and that you're most prepared for when you show up.
And sorry.
Sorry, I was gonna say, and on that note, these training sessions are for y'all, so if there's something that you feel is missing or something that like you want to contribute, then always talk to us, always like make a comment. We're happy to be able to adapt to y'all.
Slow down, speed up, what does this mean? We try to avoid acronyms, but if that comes up, anything, this is for you, right? So ask all those questions, please.
The only other thing I was gonna add is, this seems like a good point in the presentation to just emphasize that, you know, after you guys are done with these trainings, you're gonna be dealing with real people that actually need health coverage and like actually need our help. So when we say like, you know, it's vital to attend the training sessions, we're saying that because we want you to enter clinic as informed as possible. And we don't want you to, you know, put less weight on it than is needed. So, and that's, I don't mean that to like overwhelm you guys, but just to understand your responsibility as a certified application counselor. You know, we want you to be prepared, so.
Good transition.
Good transition.
What is a certified application counselor? Does anyone know what we're signing up for? Anyone give like a quick little thing, like, I think a certified application counselor is. Yes?
It's like helping uninsured individuals University of Healthcare navigate the state marketplace where people can access physical insurance through like the federal system. So that's like the gist of it.
Yeah, absolutely. Certified application counselors came into existence with some of these changes with the ACA, and we'll talk a lot about the Affordable Care Act. Not today, but in the next modules. But yeah, so certified application counselors are really there to help people navigate this process and make it easier. And so you all are getting certified through CMS, through the Centers for Medicare and Medicaid Services. But then we take it one step further and we say, now you're also a GCC volunteer, right? So you're a Get Covered counselor and you help us do the specific things that our community and our clinic needs in terms of health coverage, okay? And let's see, so our focus should be on consumer-specific needs such as their pre-existing conditions, specific providers and prescriptions that they need, their preferred financial commitment, personal preferences. But the goal is to remember that you're taking in all this information, you're absorbing who our client is and their story, and you're helping them to direct them to the resources that they need. There is no one answer, one guide, one step-by-step question that you can ask our clients. And honestly, we get asked that every single training. What are the questions I should be asking people, in what order? And that doesn't exist, unfortunately, but that's why we have these trainings to build up these skills so that we can learn who our clients are and help them. Do you have anything else? Great.
Yeah.
So just to, this next slide is the one we were just talking about, which is being a lifelong learner. And we're gonna continue to have sessions. We're not just gonna stop in October. We're gonna have monthly training starting in January. We're gonna cover specific topics that we believe are really important to continue your learning. But you're gonna see every single day, you're gonna learn something new. And I think that's the most fun part of the process is just learning those new ways to support our clients.
Yeah, and that should be exciting, but at the same time, if it's daunting, if it's scary, that's okay. Talk to us because it is really exciting. It can be scary at first thinking like, oh, I'm going to be dealing with real people, real patients, but that's something that you should be excited about because it's really awesome to actually see that you're making a difference within somebody's life. And we'll also try to have different volunteers, different people from the leadership team come and talk about different patient experiences they had and like all the fun and like the joy they're able to get from like being in clinic and being able to help patients.
And as we go through our trainings, we might actually add some anecdotes to give you all some examples of people that we've impacted. So you can just kind of get a glimpse into what it is. So we'll pass off to your person now.
So on that note, since a lot of y'all have not had an opportunity to actually get into CMS.gov, we're still gonna spend 7 minutes to like go through some of these definitions, but that link that we're talking about is here again, if y'all are able to go on there and just talk to each other. What is it, the Feynman technique of being able to explain it to like a high, like try to do the Feynman technique on this of that, not just reading the definition off, but how would you explain it to somebody without some of the jargon, without some of the more complex vocab? Yeah.
And some of this stuff you might know from personal experience. Maybe you have a health insurance plan and you kind of know some of these words, you heard your parents, your doctor, whoever talk about them. So that's also good experience to pull when you're trying to decide how to explain.
And if you actually look on the second page of the note packet, the first question or like the first little section on there is like writing out like a definition, some of these terms in your own words. So I think that's really important is that you can read what's sort of on the website, but you can explain that in your own terms. So when somebody asks you in clinic, like you tell them, you know, if a patient asks you, I'm out of network, what does that mean? You don't want to be able to read them like the definition, you want to explain that to them. So I think that's a really useful technique. So let's spend about like 7 to 8 minutes like talking with each other. Maybe talk about some of these terms that you like do know, and just sort of just have a conversation. We're also going to just walk around and help y'all with that. Yeah. Does anybody have any questions before we get started? I know we should have asked that like before we did this. I know that was a lot.
Are groups good?
Everybody good, like who they're sitting with? Okay.
Awesome.
All right.
Hopefully you're good for your sitting.
Yeah. So we'll do assigned seats.
So 7 minutes.
Yeah. Let us know if y'all have any questions or wants to come over.
So like 26.
I'm trying
Yeah.
to do all seven. My God. Oh, wait, I thought you. Yeah.
I said, honestly, if you wanna do this, it's just fine. Do, then I really.
I also have law. I think like.
How did you get that?
Because I don't, yeah, I don't know where I'm going. Like one of my classmates is
No,
right
there was somebody down.
there, and I like still never get. Yeah, I talked to the security. Okay, so like, I went all the way. Like, Instagram, and I went down.
You were saying it's a rose, like,
Good parts, right?
yeah.
It's really, yeah.
Yeah.
That's, yeah, after this one. The joy.
I moved, like, and it's always corrected.
Wait, do they actually?
I mean, for the most part, like, it's not, they do tell, yeah, like, there's children with code, but
Oh, yeah.
there's like even a thing where like actually. I'm so sad.
I got lost, I guess.
I think about it.
No, that was. No, I felt bad about taking lost up until I was this. Like I'm on straight. Where.
Oh, they all have.
Yeah, they had no idea where I was from. Like, where? So I don't feel bad.
Yeah.
I also go to the north. Like I always enjoy. No idea what happened.
Premiums like the monthly employee on.
There's one staff. And they can't put it up each. Okay, but I just want like what was he doing on our so I think next time we should try to steal some. Like, I have to work.
But these plans have this deductible. They wanna make sure they at least pay some certain amount of. Somebody can.
Things like.
Something like that.
Whatever the current insurance.
Things like that.
But. And then the. Well, listen now.
So yeah, I sort of.
Is, and I.
Things like that.
And you're responsible for paying that price around. Okay, now that's what this price is for. Another 10 bucks. No, just for the phone. They say, okay, we'll pay. So if you pay. And this is.
Yeah.
Let's get to your picks. When we determine the budget, we like say, because. It's not clear. And then. That's not another. Right, then you guys do a plan and you're. It might be easy to think about if this were 3,000. That way you can see that this is the difference. And then, you see what I mean? Yeah. It ended up being the deductible ended up being equal to what they were responsible for. 10,000. So. More money from the lower end or? It would be more money from the.
Like 1 more minute.
So let's think about this in a real scenario.
PTs.
Okay, and it says.
You don't understand the PTC?
Yeah, so the PTC is like actually that you get back, right?
Correct, for paying your taxes, fitting within a certain bracket.
Yeah. So it fall between 100% and 400%.
Correct, and if you're, and like the higher you go in percentage, the lower PTCs you're going to receive. You're gonna receive less PTCs until it's. That's the reason why there's the Medicaid gap, is because you make too much for Medicaid. Or no, you make too little for marketplace, but too much for Medicaid.
Medicaid. Yeah. And then do you understand that example that Marina did there was like the deductible and then the co-insurance, like what co-insurance is? Co-insurance is like the cost of like, let's say they got a deductible, it was what, I think it's like 10,000 up there. So they got a bill for 30,000. And they got a bill for like hospital bill for 30,000.
Yeah, but she's talking about the 20% being the co-insurance, isn't it? Yeah,
would you be able to explain that?
yeah.
Okay, maybe if I can.
Wait, sorry. I just want to double check, because she has the bracket over the whole thing.
Can you explain what you said before?
Well, no, the bracket, are you talking about the 20%?
Yes,
Okay,
like I was saying like this.
no, I got you.
Yeah. Here's like.
Both things, right? Yeah.
I don't think that math is, oh, wait,
It's
no,
30.
never mind.
30 and 10.
No, it's 20 and 80. You were wearing glasses.
I'm talking about the actual number.
Oh,
30,000
yeah.
and 10,000.
Yeah, it's 30,000 and 10,000.
Yeah.
I thought you were saying that 10,000 was 20% of 30,000. I'm
I
so
can-
tired.
If you want me to do a problem, or unless y'all feel good, so let's do a math problem. Just to show it.
I'm sorry.
Every plan has a document.
Are you good, are you good with that? Are you good with like following diagrams going out there?
But they're going to look different.
I think we should.
Yeah. How's everybody feeling about that? We pretty comfortable with a lot of the terms, or at least felt a little bit better after talking a little bit about them? Okay. Let's see. So, so let's look at the first one here. So health insurance versus health coverage. Somebody want to talk me through sort of how, like, the difference between those two and sort of what they talked about? Any volunteers? No pressure here. It's like we're just here to have a conversation. Yeah, what's her name? Alexa. Okay.
Oh, that's awesome. Does anybody else have anything that they said different in their group? Or something that they want to add to that?
So this term becomes relevant in the clinic, you know, tell us why.
Yeah, so the reason like why Zara brought that up is a lot of times when we're in clinic, you're gonna hear us like refer to health coverage a lot more than sort of health insurance, because sort of like what you said, health insurance is like sort of like a smaller term for like more like a contract that, you know, it requires you to pay like your health insurer. So sort of like I said, it's like a contract, right? But that's health insurance can be like is limited to sort of like, you know, something that you get from like marketplace, something like that. Whereas health coverage is more like a larger umbrella term, and health coverage can include things such as like UNC financial assistance program, which we'll cover in like the 5th training module. It can cover, you know, a lot of other governmental assistance programs. So I think that's one good thing to like know the difference between the two, and just like sort of be mindful about, you know, when you say you volunteer for SHAC, you know, necessarily like don't say that we help people just get health insurance, rather say we help people with health coverage, because that's like a more encompassing term. Anything to add to that, or?
Any questions about that distinction?
It also can be important sometimes if another volunteer in the clinic or a med
You go with
team
that
or an
next.
attending
Or no, we have to cover-
What do you do for the clinic?
Oh, no, it's just different
You
types of
can
insurance.
explain
and
that.
different types- I guess. Well, no, let's finish the conversation up here first. Okay. Yeah, so talking about health insurance and health coverage, we have health coverage here and then insurance here, just different types, and you don't need to memorize any of this. We'll be talking about a lot of these programs throughout the rest of these training sessions in depth, but just like from a 5,000-foot view, different types of insurance, things like Medicaid, and then CHIP is also something that you're gonna see a lot in the modules. CHIP in North Carolina has merged with North Carolina Medicaid, because they cover similar groups. And Medicaid will also be expanding in December.
Effective
Potentially.
December 1st, yeah, which we'll get into that in the next training.
We also have Medicare, TRICARE, COBRA, and Marketplace. Marketplace is something that's gonna be covered extensively within the CMS.gov modules. And it's also going to be incredibly important during the November 1st to January 15th. But Marketplace also extends beyond that. And we'll get into that much later.
And then
Yeah, and then these are the different types of coverage options that we particularly use a lot that you will not see in the CMS.gov modules. And that's the reason why we added that 5th session at the end to be able to go over some of those. So like UNC financial assistance is something that you're gonna see a lot. And also working with MAP and the North Carolina Medicist program to be able to help get prescriptions. Because as you'll see through going through the modules, health insurance can be a little bit nebulous and you don't quite realize just how many different things there are. like vision care, dental care, medical, prescriptions. And so you're gonna see that a lot of health coverage options are really good to be able to supplement a insurance option as well.
Let's go back to that.
Yeah, and so going back here, network versus out of network, or just what a network is. Did anybody talk about that in here? Or have a good explanation? What's your name?
Austin.
Austin.
Yes, we just said that network is kind of providers that are preferred by.
Gotcha.
So in that the providers for costs.
I like that. Anybody else? Something different, something to add?
And what would out of network be? If we describe like in network, what would out of network be then? Yeah, sorry.
If you're positioning yourself as a part of network, then for you, that means that insurance effectively uses to cover most or all of the cost of that service.
Correct.
And if you're like, if you have your insurance card with you, you can even pull it out and see that there's gonna be a little INN and then there's OON. You can see what those differences in cost would look like.
Yeah, and like summarizing all of that, so a network is gonna be like the list of like doctors and hospitals. And that term, like doctors and hospitals, it also like covers like other like providers as well. We're not just limited to what doctors are. That consumers are generally required to use to get coverage. So if you're using a provider that's in network, the services that you have with the provider are gonna be covered, or a lot of the services are gonna be covered. And then likewise, out of network, the services and providers are not gonna be covered. And some. Yeah, okay, yeah, and then one thing we wanted to point out here is that the graphic that we see here on the slide, these graphics are like these like images are directly from like the healthcare.gov website. So they, make a lot of resources and things like that. So as we can see here, it says.
It's also in the back of y'all's packets as well.
Yeah, oh, that's right, yes, and the yeah. Yes, yeah, it says. On the bottom, it says Kate can pick from many doctors within her plan's network, and then by picking an in-network provider, her plan will cover more of her costs. So like, one of the things that, you may see us trying to do in clinic is that, so-and-so patient may be trying to like see this provider, but that provider may not be in their network. So, we may have to do a little bit more digging to find another provider that's able to provide them the same service, but someone that's in their network. So that's just like, we think that y'all think that we're just like trying to show you these terms, but this stuff is like actually applicable when we actually get into clinic and like looking at in network and out of network. Have any questions? That one?
Yeah, and like we said at the beginning, this is very definition heavy just because these are some of the fundamentals. Don't worry about memorizing it, but just be able to recognize these terms because they're going to keep coming up. And the more and more you see them, the more and more they're going to make sense, and the more and more you're going to be able to actually use them in conversation using your own language with it. Yeah, and I would say that this one is probably the most important one as far as fundamentals. So what did people say about premiums and deductibles?
Yeah.
Yeah.
You say before that, before insurance. Yeah, before insurance starts to cover a large amount of your costs.
One more follow-up question that I had was, what's the time scale for premiums and deductibles? Like, how often are you paying a premium, and how often, or what is your deductibles timeline? Yes, no, you're right. Yeah, what about a deductible? You also don't have to answer this. This can be like for the whole group. Well, no, it is a amount. So like, I think Zara, the example that you had up there, and we're also gonna have Zara do an example up here, but I think it was 10,000 was the deductible that you had set. It's I was gonna say that it's for a yearly cycle that you have that deductible. And then once you hit that deductible, actually, I'm not gonna get into that part. It's on a yearly basis, but yes, you are right that it is a fixed amount. I don't think there's anything else I wanted to say about this.
So with a deductible, you can also hit it at any point, right?
Yeah.
You could hit your deductible in February, you could hit it in November.
Yeah.
Doesn't really matter to insurance companies, but it does matter to you because depending on when you hit it, that'll change how much the remainder of your services are gonna cost, like, Kathleen? Yeah, okay, great, like Kathleen was telling us.
Any questions? And then the graphic here for premium that we have is that like, see on the bottom it says Kate's plan charges a premium of $346 a month. So that's like, you know, what she's getting charged from her insurance monthly. And then the next slide, we have the deductible. So here it says like Kate's plan has a deductible of $1,000. So at the start of her cycle for insurance, she must pay that $1,000 or that whatever set amount it is, not necessarily always $1,000 on her own before her plan starts to pay for future services.
There is a note here, what are some services that are typically covered either way, you can hit your deductible or do not?
There's one of them, but a lot of, like preventative services can be covered, so like.
Immunizations are almost always covered, especially with the ACA and requiring that for plans that are considered that minimum essential coverage. I think sometimes you can also get certain like family planning, services as well, so but it depends on your plan, usually it's this preventative measures.
And then we'll do co-insurance. Okay. And then I think the next one, and then we'll do like a little example problem is like co-payment versus co-insurance. Any thoughts on that? Yeah, what's her name? Arsenal.
Yeah, so like you were saying, co-payment is a fixed, like the biggest thing to get from this is the fact that a co-payment is a fixed amount versus co-insurance is the percent share of cost for the different services that you're gonna be receiving. And yeah, I was also gonna say, correct me if I'm wrong, but usually a plan either has a co-payment or a co-insurance attached with it.
Well,
That they
and-
either, sorry, I was gonna say that they either go by fixed amount or they go by a percent share that you have.
Yeah, for each service, it'll be service specific,
Yeah.
so usually like in hospital surgeries, we'll have a co-insurance now versus primary care appointment or a specialty care appointment, we'll have a co-payment attached. So it depends on the service, and we'll talk about this really fancy chart that kind of lays out all the costs for people that they can look at. You can even pull it up for your own plan and see what they could look like for these co-payments.
Do you want to do it up here just so that it's on the recording as well?
That's helpful. Can you all see if I write up here?
Might-
Would you be able to see this over here? Yes, okay.
Okay.
Okay, so let's start out with a premium. Can anyone give me a premium amount? How much do we want to pay a month for our plan?
This is for my insurance too.
Yeah, okay, so Yash, so we're the insurance company, we're creating Yash a plan. How much do we want him to pay a month? 150, okay. So every single month, he's gonna pay 150, that's
Okay.
$150, right? Okay, so when is he gonna pay that?
I think it's like a little higher.
What was that? Is that hard to see?
Oh,
For the
thanks.
Zoom.
Oh, it's high for the Zoom,
Yeah.
oh.
So you
Hmm.
can adjust the- No, if you just bring this down a little bit.
Okay, bring it down, but it's not too, like, is this too low for y'all?
There you go. It's perfect.
It's perfect, okay, thank you. Okay, so when do you pay this 150?
Every month.
Every month, yep. Now, when someone enrolls in a plan, it's important that we remind them that they are not enrolled in a plan until they pay their first premium. Okay, so they first pay that 150. Okay, so let's say this goes on and on for the next 12 months, but let's just do 6 for now. So we are in June, okay? So this is what Yash has paid so far. How much do we want Yash's deductible to be? That's gonna be the amount that he has to pay before we start helping him. 2,500? Ooh, steep. Okay, let's do it. So deductible, I'm gonna write it here. I know that we can't see that on the board. But 2,500 is our deductible. So what does that mean again? Exactly, the amount he must meet. Now, does that count all of these premiums? No. So on top of all these premiums, he's gonna have to still meet this 2,500. So let's say that Yash goes to the doctor and he goes and sees his primary care doctor, and his primary care doctor says, Yash, you got a bad case of what year are you? A junior? You're a senior. He's got a bad case of senioritis. You need to go see the senior itologist, okay? And that's gonna cost, what are we gonna cost for that? How much is that gonna cost him?
$10,000.
$10,000? Good lord. That's a crazy specialist. So what is that called though, that amount for the specialist? What is this amount called? It's a set amount. Verena said, we're gonna pay $10,000 every time you go see your senior itologist, it's $10,000.
Because it's incurable, that's why I said that.
Oh, wow, okay.
Just like the cost.
Cost of services, co-payment, that's our co-payment, exactly. Okay, so that's our co-payment. So, but he goes and sees his primary doctor first, right? Who referred him to the senior itologist. So primary care, I'm gonna be nice, that was $30. And then he has to go and pay $10,000. Oh my gosh. So now how much has he paid in, let's say these are going up to February, and that's when he's getting his services done in February. How much has he paid so far in February?
That's a calculator.
How much do we have? Can we do some math here?
Yes, whoever said that number.
What was the number? I don't know what it is. 10,300. 10,330. Okay, perfect. So that's how much he's paid so far. Now let's say Yash goes to the senior itologist and he says, well, I can't cure this, but you have a third fibula and we might need to get that removed for you, okay? So he's gonna need to go into surgery and get this third fibula removed. And that's gonna cost him let's say that's gonna cost him $20,000 to get that surgery. Okay, so now this is an inpatient surgery. He's gonna have to stay there for a few days. We're gonna have to get rid of this fibula. And he's already paid $10,000 at this point. So what's now gonna kick in for Yash? His co-insurance, right? Why is his co-insurance gonna kick in? He's met the deductible. Okay, so let's see what we have. So the deductible was $2,500 and he's paid this $10,300 right here. Let's do some math here. Deductible is $2,500. Take that away, and that gives us, anyone with a calculator? 7, maybe, I don't know. Someone, 777, let's just say it, let's just go with that. Okay, so 7770 is the amount now that is remaining after he's met this deductible. So insurance is gonna say, okay, I'm gonna help you out with this, right? So this is the remaining cost from your senior itologist appointment. Thank you, I made up a complete number here, 7830, Brianna says, okay. So the insurance company says, well, I'm gonna help you out with this much because you have this crazy bill right here for your senior itologist. And then in addition, we're gonna help you out with this surgery. But I'm not gonna pay the whole thing. What's his co-insurance gonna be? Give me a percentage out of 100. 80% is actually really high because that means that you have to pay 80%. Yash has to pay 80%. We want to do 20?
Yeah.
Okay, let's be nice to him. Let's do 20%. Okay, so he has a 20% co-insurance. So now we're gonna add these two costs here, which gives us, that's easy to do, 27830. And Yash is responsible for 20% of that, which is what? 5,000, somewhere around 5,000? Okay, so Yash has to pay 5,000 and then insurance is gonna pay the rest. Now, Yash has met his deductible in February, so any other services he has after February, what's gonna kick in? Co-insurance, right? If I moved all of this over to October, where we are right now, then Yash would have, if he had not met his deductible before October, insurance wouldn't be covering any of those co-insurances. Okay. But what's really cool about this is that you actually can do some math, and usually there is a set amount of money that you can tell your clients if you have the senior cytologist and the fibula doctor and all these other crazy people you have to go see this year for your health. You will likely pay this top amount of money, right? We can usually give people that amount of money. And we'll show you as we get through healthcare.gov, there's a way to even kind of list off that this patient is going to be having a lot of services or this person's going to be having few services. And you can help them estimate what their amount will be. Okay. So it is, in the end, it's just a lot of math. We had to pull out our calculator, but it's important that you kind of understand this. So maybe work through some questions with each other at some point. We can also talk about this later, but usually we're not doing a ton of math with our clients. It's
Yeah,
just a good thing to
wanted
know.
say, like, this isn't what you're doing on a daily basis, but I think it's an important thought experiment because you should be able to look at any of these numbers and know what it means and know how to explain it if needed. Like you're not necessarily going to be crunching these numbers all the time, but you should theoretically be able to have done what Zara just did based on knowing the definitions.
Yeah, it's like A squared plus B squared. You don't actually like use it that much. You just need to know how to book it.
Does anyone have any questions right now? Yeah. What's your name?
I mean, so hypothetically, if they were to like not have this $30 or $100 and like give let's say, and then all they paid is the monthly premiums.
Mhm.
And then let's just say they have like this massive surgery, whatever where they need the insurance to kick in, you could pay the rest of whatever insurance is in to.
Exactly. So if this didn't exist,
Yeah.
then they would pay the 20% off the 20,000. So they would be paying 4,000 instead of what we had was 5,000 here.
Okay.
Yeah.
Want to keep going with the example?
Sure, if you want me to. Okay, did that answer your question, Aditi? Yeah, Austin.
Make sure that I'm, the 150 is for premiums, right?
Yes.
Is that going towards your deductible?
No,
Great
It's going
question.
towards
Okay.
you being able to have your plan in the first place.
this
So-
does not count.
So the way that insurance plans work is that you're paying a premium, which is like monthly dues, basically.
So in her situation, whenever it got to that point, you didn't take premiums, you had to pay your full deductible first before yours.
Exactly.
Completely separate number.
Premium goes separate from the deductible.
Yeah, sometimes we were kind of mean to Yash. Sometimes people have a $0 deductible, and we'll talk about that when we get to the premium tax credit value, but you can have a premium that ranges from usually like 0 to around 400. The deductible can range from anywhere from 0 to like 10,000. So it's important to kind of understand, like Verena said, we're not crunching numbers, but it's really important to understand how those numbers ebb and flow and how that will impact a patient's overall bill. Yeah. What's your name? Amik. Just speak a little louder. You can meet it at any time. Yep. Mhm. Mhm.
So like next year in October, the deductible like happens again, so that would be easier, and you already met it earlier, would insurance cover everything before?
Let me make sure I got your question right. So you're saying if whenever you meet your deductible, does insurance cover everything after that point until you hit 1 year? Yes, it does. Now a lot of people will start their plan on January 1st, and we'll talk about like the open enrollment period, which opens November 1st, but then plans usually kick in on January 1st. But you're right, there are some times when people can start their plan at different points because maybe they lost a job or they gained a job or, gained a family member. So there are times when you will start at a different point, but it'll still be a full year that your deductible lasts for. And at any point in that year that you meet your deductible, then insurance covers the remaining part. Yeah, 2 questions. Okay, good. Yes, what's your name?
My name's Leanne.
Leanne?
So to make sure, like, in like a scenario, if a person needs more, is probably having more services, high deductible and low premium will probably be better for them? Or is it?
If they're having that's a great question. So if they're having a lot of services, a high deductible and a low, is that what you said?
No, low deductible.
Low deductible and high premium.
I think that's what
Yes.
you're needing to say.
Yes.
Yeah.
Low deductible and high
Want that
premium,
insurance
yes.
to kick in. If you
Yes.
require a doctor, you
Yeah.
want to have a low deductible, that way you're then
Mhm.
having assistance with it. But
Yeah.
you're also thinking about it in a good way, because I don't think that we even touched on it, the fact that with health insurance plans, premiums and deductibles, it's not exact, but they tend to be on a seesaw of that if you have a high premium, it's most likely gonna have a low deductible and vice versa.
Yeah.
Yes,
And
that's
then-
a really good question.
Exactly. We've had patients who, clients who say, I'm expecting to have a surgery this year, or I'm expecting to have multiple surgeries. So that's why I want to kind of look at other options so that I can cover that more effectively. Or we'll have the other way where I don't expect to have really anything going on for myself. I'm just kind of having insurance to prevent things and make sure if something does happen, I have something to fall back on. And so maybe I want a low premium. I don't want to pay a lot every month because I'm not really expecting to use the doctor.
Does that make sense though? Like if you're never going to the doctor, then you don't want to have a high number that you need to pay before your insurance starts kicking in. But you also don't want to be paying a lot per month because you're not going to the doctor very much. So you would want a low premium, and then it's okay if you have a high number before your insurance starts kicking in, because you're probably not going to be going to the doctor very much. Does that make sense? Okay.
What was your question?
So.
What's your name, Bella?
Asia. Is the car insurance only kick in after you meet your deductible, or if you're not getting any services and you're trying to meet your deductible, does it kick in?
So let's say we had changed this number. I forgot who told me that it was 10,000. Oh, Brina. So let's change this number to 2,000. If we change it to 2,000, he's only met $2,300 at this point. So he's not met his deductible. So insurance is still like, you got it, buddy. Like you keep going what you're doing. After he meets that 2,500 is when they'll kick in. So they wouldn't have helped at all with any amounts before.
That would have sucked if they did though, because if they did, that means you're not meeting your deductible as fast because they would be paying for stuff. So it wouldn't really make sense for that to start kicking in until you pay your deductible.
Yeah, so you'll pay for services up front at the beginning. And then,
Yeah, people usually like will tell us, or maybe you've even heard like your parents say this before, like, we haven't met our deductible, like we'll put, like people will actually plan around their deductible and push back surgeries if they can, that they're in the range where, now it's gonna get covered, or, you have to really like work around those numbers a lot of times. Yeah.
yeah, because it is, sorry, I was gonna
Yeah.
say, because it also isn't just family or not family, financial situation that is how you're going to not dictate how you're gonna assist and how you're gonna write different plans and go through that process with them. It's also the fact of what do they need the medical services for? It's what they need it for. And so some people who have chronic conditions, that's something that you might not think of asking in a conversation, but it's something that's very important. Because that then is crucial information that can help you assist them better. Or, sorry, did that answer your question though, Aisha?
How did you change the amount?
Mhm.
of how much that- that's like, get that surgery, so he still has like
Mhm.
$200 left on his, he
Yeah.
has like a certain amount left on his deductible, so he pays for that
Mhm.
out of pocket for the surgery that he had.
Yeah.
And so the 20% that he pays for would be like out of that subtracted
Yeah.
amount.
You basically end up paying more for the surgery because that portion, that $200, you pay 100%. And then the remaining 1,980, 800, whatever the math is, you pay only 20%. So you are paying slightly a little bit more in that case. Yeah. We're going to go through this last topic. We have this last set of questions here, which is, what is this doing? Which is the out-of-pocket costs and then out-of-pocket maximum. So we'll do this really quickly.
Yeah.
And then we do want to get to some practice for you all.
Yeah, so I was gonna say that for out-of-pocket costs and out-of-pocket maximum, out-of-pocket costs is within a health insurance plan. It's also going to say that within the year in which you're having this plan, we're only going to have the consumer pay for X amount total. So deductibles also factored into this, and it's also the co-pay. I want to make sure that I'm not mixing up co-insurance. Yeah. So it's the co-insurance that you're paying after you've already met your deductible. So what was the what was the deductible that y'all had?
2,500.
Yeah, so 2,500 is the deductible that here, right? Yeah. So 2,500 was the deductible that y'all had here. Let's then say that the out-of-pocket maximum is, thank you. let's then say that the out-of-pocket maximum is maybe 10,000, that within the year, Yash is only gonna pay $10,000. And so say that there's an absolutely horrific accident that happens in August, school starts. In which case then he's having to go to more doctor's appointments, he's having more surgeries, and eventually he's gonna reach an out-of-pocket maximum. Out-of-pocket maximum is then all the, it then means that insurance is going to pay for everything else.
And is that similar to like that top number you were referring to? So this is like the number that, when we look for plans, like this is numbers that they may like also provide, you know, on the plan. It's like, this is the top line, like maximum number, if like maximum that you would have to pay, given, you know, everything that you would need. So that's like the top line number. That's what an out-of-pocket
Yeah.
maximum
But
is.
notice how the premium is still untouched, so premium, you're still paying that.
Yeah. Because that's not actually going towards your actual health, it's that you're paying this money so that you can receive the service of the health insurance. It also doesn't cover out-of-network services because outside of what the insurance plan said that they were going to do.
Very good with PTCs.
Yeah, also, one last thing, all these things, premium, deductible, out-of-pocket costs, the copay, the co-insurance, it is a requirement for these health insurance plans to list that out. And we'll show you eventually how you're able to go through and find them specifically and how you're able to also explain it to patients. Whew. All right, premium tax credits. Premium tax credits apply to people who are paying taxes and fall within 100 and 400% of the FPL. And so the critical value here, and I also think that FPL changes each year.
What does FPL stand for anyway?
Thank you. It changes each year, right? And so I'm just gonna skip by to be able to show this. Don't memorize these numbers. You can very easily Google this when you need to use it, but y-axis is the number of people within the household, and then x-axis is from 100 to 400%. And so this is just showing you the numbers, but a premium tax credit is helpful because insurance plans cost a lot. Premiums are very expensive oftentimes. And so if you fall within this range, you can get a refund on your taxes, which is a premium tax credit. In which case, oftentimes you're able to, if you're closer to the 100%, you can sometimes have premiums that cost $0. Bless you. Versus if you're closer to the 400, you might get a reduction in the premium, but you're still going to have to pay a decent amount of that premium.
I think it's called a premium tax credit, so what do you have to do to get the premium tax credit? You have to apply. And then
Yeah.
You have to be paying
Pay
taxes.
taxes.
That's important. You have to be paying taxes, so it's amount of money that they'll give back because you're paying those taxes. And like Grayson was saying, there's the range from 100% to 400%, and you get more money if you fall on the 100% side. You get less money if you fall on the 400% side. And I think Madeline, you would ask me about if there's PTCs after 400%. In some states, I don't know if it's North Carolina as well, but in some states you do qualify past the 400%, and that's something new actually that they just considered. So it's case by case basis. Always go off of healthcare.gov, but 100 to 400 is our general.
Yeah. And even though, like Grayson said, obviously you don't have to have the numbers memorized, but it is kind of helpful to know that 1,400 number, roughly up to that kind of 60,000. Having those general guidelines in your head, I think, is somewhat helpful. Just so you kind of have an idea of the type of incomes that would qualify you for something like this.
Yeah, and it's also important that's for a one-person household, and so with the more people that would be on this plan, it then increases the income.
Let's skip
Yeah.
summer benefits and coverage
Yeah.
today. We'll come back to this
Yeah,
next
we'll-
week.
We'll be talking about marketplace, and there's also something I want to say about where PTCs apply, because they only apply to marketplace plans, but that could be next week as well.
We can skip this too, maybe.
You guys should probably answer those on your own though.
I know,
Yeah,
Bryson.
I'm sorry, y'all.
We're just short on time, y'all, but there are 2 questions that we wrote here, and please do answer them. We'll start with them.
Yeah.
We'll see if you can get me.
These questions though, Oh.
PTCs are important though, so are
You
there any
wanna do-
questions about
next week.
what they are?
Okay, so this question, this was my question because I was asked this about a month ago by a patient. And it's, why do I need health insurance or why do I need health coverage? I don't really go to the doctor that frequently. Why do I need it?
And the event that you encounter an unexpected but really expensive medical costs or expense or big costs, for example, it'll help with like, it doesn't be financially like the cost of running for preventative.
Anyone else? To speak on your point, there's a patient I was talking to last night that didn't have health insurance and had gotten in a car accident. And so I'm then trying to like work through this with him because he's getting sent over to UNC and trying to figure out how we can best help him. And so accidents, yes, but also I want to touch on preventative care because I think that that's incredibly important. That a lot of people who don't have health insurance then don't have good access to a doctor. And so something that can be very simple and very easily manageable, such as somebody's blood pressure, if they're not able to get to a doctor because it's too expensive and they don't have the health insurance to make it more accessible, that then can cause it to go out of control. You have renal involvement. And it's a very extreme example, but it's something that actually happens a lot more often than what you would expect. And so, yes, preventative care as well. And yes, emergency situations. We don't have that much time, but are you able to talk about the penalty with them real quick?
Yeah, super quickly, there used to be a penalty, so basically when the ACA was passed in 2010, it was required that everyone had insurance. And if you didn't have insurance, you had to pay, an amount of money a penalty. The reason for this was to incentivize having this preventative, right? So it was just a way to ensure that everyone felt like it was important enough to get insurance. The Trump administration removed that penalty because of things that we, political reasons that we don't have to get into right now, but basically they removed that penalty. So now there's no financial incentive for people to have insurance, but it's important for us to also still know how to enunciate why it's important to have insurance. And Grayson told me this, I haven't had a patient directly who's asked me this, but we've had patients who have said, if I'm not gonna get penalized for it, why do I need insurance?
Yeah.
So it's important to know these reasons and be able to kind of explain that there is free preventive care. Oftentimes we can find you a plan that doesn't even cost anything a month. We can get your premium down to zero with these premium tax credits. We can find something that works for you. We wanna make sure that you're covered in case of an emergency. So
Or your
there are
twins,
still
same
really
thing.
important reasons why people
Yeah.
don't have.
That's gonna
coverage
take
that
too
is
long.
non-investing.
We
We want to get to the second question, which is getting you all acclimated with the marketplace. And we're gonna just throw you in if you're up to the challenge. So go ahead and just pull up this website, healthcare.gov/c-plans/# or hashtag, whatever. This is a website, a link that you will use all the time. And you can see, like, I've kind of sealed it into my head now as well. But we hope that eventually you're gonna get this link kind of very familiar and you're gonna be pulling it up all the time when you're in clinic. So go ahead and just try to take the information that you see in this question and put it into this website as if you were a first-time user, which you are usually. So just see if you can try to figure it out and work with the people around you. You don't have to do this alone. You can kind of help figure out. We want you to get to the page where it says, what does it say?
See plans and prices.
See plans and prices. We want to get to that page.
And we can
This
walk
is-
around and help.
This is a really important page, especially during like the fall seasons when
Really?
people are going through
Who's getting-
open enrollment, that this is something that you want to know a lot with. Also starts to get you familiarized with sort of some questions that you might want to ask patients. when you're talking to them.
Would you be like a bit more,
Grayson.
So one thing that you can look up the eligibility, but another thing that you're able to do is that as you're filling out the information, if you don't put eligible for Medicaid, you just keep going, but the person that's eligible, it'll flag it and say, hey, this individual might be eligible for Medicaid, and it'll send a link to you, or it'll show up a link that you can go to be able to go through that process.
So there is something else though in this question. Just John, share this page.
But the thing on the back, what is the claimant's dependent? Is it gonna be, or is it the claimant's one dependent too? I'm just doing it right now. Okay, so let's just do
No,
it. So
because
this
you
is
put
for
down
him.
that he has a spouse, right?
Yes,
Yeah, so no, he only has two.
I think
That's,
you're.
two.
Yeah, so. you
yeah,
probably
wife
know-
shouldn't be claimed.
Okay, so age 35, he's male, is he eligible? He's not eligible. No, he's not.
They're on there.
He's a legal parent under 19.
Because you're getting insurance.
Spouse is what, 30, female, legal parent, no pregnant, nothing.
No tobacco user, no nothing.
Dependent 1, age 2, female. And then 5, right? Okay,
Yeah, let me
5,
see what
female.
you come up with, just go.
So 2, he's a parent, 35, male, parent, 30, female, spouse, 2 and 5.
Okay, you can start looking.
What happened? A sharp pain in my side.
No,
That's
so they're
correct.
there, so they can be eligible for.
Yep, and which you would go to one.
So, yeah.
Okay, I thought you were gonna say, like, no, that's not my bad.
Can you go back to the chart really quickly? The FPL chart.
The what chart?
The FPL, yeah. So let's see, 4 people, so that's like between, yeah, it's under one.
Yeah, I
You can go back.
That's not wild, I just want to know. It's like to encourage. But I realized.
Yeah.
Yeah. What if these are?
Yeah, it's
I'm sorry, Annika. You did all that cutting.
I know. I'll hold it against you guys. I got lost trying to find the.
Okay.
Oops, so my part right here. I cut it to the. You can do that, like, it's just that they're really fast.
With children and.
Third goes into marketplace. So we're gonna go down these, like, first. Like. Fourth is talking.
Yeah.
And then 5, which is good, like what is social, what is financial assistance.
Really great job, and that's what is, we're all of our volunteers, you're on. Oh, right, okay, that is not school, we are not here to say. You're supposed to make sure that they are making. So we have set them these, in our heads, are like, we're great, a lot of people would do, if you afford this, then you can kind of think about that, and then reassess the other ways. But that's your main job, figure out which resources are possible based on the eligibility criteria that I'm talking about, right? And based on that, making sure they know what is possible also. So it's talking to the person and they also fell within some guidelines or the other stuff that we talked about. And your role is to give them those resources. But your role is never to be like. Yeah.
Sorry, I was gonna drop that one. Yes, we're not making this for them, but we're assisting, but the main thing is that there's a lot of definitions, there's a lot of criteria and stuff, and so we're helpful so that consumers don't have to participate. And we're able to.
So let's just make sure that you all were able to get to this page here. So was everyone able to see the two groups? Is everyone able to work through the questions? You kind of read what the different prompts said. You're gonna get so familiar with those different prompts, but we also like to work with our clients and actually work through it together. You don't have to take the computer from them. You can show them the computer and ask them to fill it out themselves. But basically, once you're getting through all those options, those questions that are being asked of you, you'll often see families are divided into groups, or if there's one individual, they'll still be listed and it'll give you some options. So for this family, the children were eligible for Medicaid, likely, right? It says that they may be eligible, so you need to go ahead and help the children apply to Medicaid. And then the adults were not eligible for Medicaid, and we'll talk about why there's a difference between children and adults being eligible. But the adults were not eligible for Medicaid, but we were told that they get a great premium tax credit. They get $930, okay?
Did anybody go and look at plans after seeing this page and you see how the premiums just hit the ground? Yeah.
So the reason they got so much money, does anyone know why? They were on the high end of their premium tax credit. It was the dependents made their household size larger so that their income was on the low end.
Yeah,
right?
so they made 38,000 for a household of 4, which puts them right in between 100 and 133%. Something else I wanted to say on this page as well. I heard some people saying like, oh, like, are the kids like eligible or are the parents eligible for Medicaid? If you don't know, it's okay not to put it down, like to check that box, because this page does show up of saying that, hey, they could be eligible. Let's go and check. And so don't worry about that. This is like a really good tool to be able to just like guide you through the process. But yeah, I just wanted to make a note about that.
Yeah. So we're at time. We're a little bit over time, and there was one other question we want to get to, but we'll start with next week with going over that question. And then if you can look at those 2 multiple choice questions as well. If you have any questions over these next few days until we meet again in a week, feel free to email us. I know a lot of you are going to be working on your CMS and like, you know, sitting on the phone with them. And trust me, we empathize for you all. And we're behind you. Just stick with it. It will get done. We've had a lot of our volunteers have these issues and eventually get through the process. And then we'll get you caught up on the modules. Okay.
And if there are any questions that you have right now and you don't want to forget for next week, like, well, we're still here if you just want to come up and ask.
I have
us.
nothing better to do.
It was so
Thank you
nice to
guys
meet
so
you.
much. It was nice to meet you guys.